Hi, today we're going to do a blood glucose level sampling. How that works is it takes the glucose in the blood and it interacts with chemicals on this test strip, and then it's going to send a current into the meter, and then we're going to get our level. First thing we're going to do is calibrate, so we turn our meter on, and then once it's on, we're going to put the zebra side of the test strip in, and a code is going to pop up. It says C25, which then matches the code of our test strip, which is on the bottle. Then to calibrate, we're just going to take this solution, make sure we shake it very well, and we're just going to apply a dab of it into the meter. And it gives you 5 seconds to put all of that to fill up the yellow meter. And then we'll get a reading, which is at 132. And we'll look on our bottle then, and the range is between 106 and 141, so it's calibrated accurately. And then we'll dispose of this. And that's it for calibration. And then we're going to go into proper safety during blood glucose levels. So we're going to go over to the sink and wash our hands.
Okay, before testing, it's crucial that your hands are clean and you follow as many safe procedures as you can. So we want to start off by washing our hands. Make sure the water's warm. Go ahead, grab your soap. You want to get a nice lather. Now, while you're doing this, you want to count. You want to sing the ABCs. So we'll go through it: A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, V, W, X, Y, and Z. All right, so we got a nice lather. We're gonna go ahead and rinse it off. We want to have our paper towel already rolled out of the dispenser, so we don't have to touch anything, so we can keep our hands nice and clean. I'm gonna take the paper towel, shut the water off with the paper towel. If you need any extra paper towels, go ahead and use the paper towel. Dispense some more. Dry your hands off properly, and dispose of the paper towel.
All right, I'm going to be tested first, and I've been fasting for about 13 and a half hours now. First we're going to do is insert our needle, so we're just going to push it in. And then to remove the cap, we're just going to twist off. Make sure we don't bend the needle at all. Now that that's set, we're going to put the cap back on. It is loaded right now, so we'll show you if you press down this button, the needle will come out. It's really fast. To caulk it, all you have to do is pull this back. So our needle's all set up. Then we're going to set up our meter, put the zebra stripe side of the strip back in. Make sure the code pops up for it. The code is correct. For our testing site, we're going to use the side of our index finger. Other patients might have to use their palm or their forearm, but we're going to use the side of our index finger. It's already caulked and loaded. We're going to hold it up and just press down. And then you might need to massage the finger a little bit to get the blood out, to make sure enough. We need enough blood to fill up this yellow meter on the strip. And then we're just going to try to scoop it in. There we go. And then it's going to give you 5 seconds to read it. And it's reading at 93, which is low, which was to be expected because I have been fasting. All right. Done with that, and now we're going to move on. We have to properly dispose, so I properly dispose the test strip. I'm going to take the cap off and properly dispose of the needle.
My job was to eat a normal breakfast, so I probably had breakfast I'd say about an hour ago. So we'll do my test, and my value should probably be about normal value. So what we'll do is first we'll put in the needle into and then we'll just twist, dispose of this, put the cap back on, put it all the way up to 9 so we can get the maximum amount of blood for the testing strip. And then we'll caulk this, we'll load it up. Next we'll prick the finger to get the blood. Again, you might have to massage the finger to get the blood out. we'll just wait a couple seconds. And my results are here from the testing strip. Was a 116, which is typical of a normal blood glucose level for just a normal breakfast.
Okay, my part of the project was to have a large amount of sugar and carbohydrates before I tested. So approximately 20 minutes ago, I chugged a bottle of Cherry Coke, which is loaded with all kinds of good stuff. So I'm gonna go ahead, I'm already set on 9, I'm already loaded, ready to go. I'm gonna go ahead and go in here, give myself a little prick. Make sure I get as much blood out as I can. Okay, I'm gonna take the strip. It's on there, let it go. Okay, my result was 166, which is approaching hyperglycemia, which is kind of high, and that's typical because I just drank a liter of Cherry Coke, which is high in sugar and high in carbohydrates.